The long-term health effects in Bhopal have also been closely watched by Dr. Neil Anderson. He was sent to the city by the Royal Commonwealth Society for the Blind after early reports of the gas causing permanent damage to the eye.
Officially, MIC is classified as about twice as lethal as cyanide. Immediately after being exposed to MIC, the eye shows basically a burn in the mid part of the eye, which heals fairly rapidly in both human and animal model. After that, there is a period of increased sensitivity of the eye with the watering. And at the microscopic level of the eye, now going on some time, we find evidence of chronic inflammation.
Working in Bhopal and at the TUC Institute for Occupational Health in London, Dr. Anderson and his colleagues also began a series of controlled animal experiments using MIC gas. The results prove that the gas causes damage far beyond the eyes and lungs.
The liver is fairly badly affected. The spleen is very badly affected, again related to dose and getting worse over time. And finally, the kidney seems to be quite severely affected. Worse in animals that have had more exposure, and something which doesn't get better as the life goes on. It seems to get worse.
In the past year, Dr. Anderson and his colleagues in India have been analysing the information from Bhopal to see if the laboratory findings are repeated in people exposed to gas. Their work again seems to contradict Carbide's optimistic statements on the future for the gas victims.
In the third year of follow-up, we found a fairly convincing excess of infections, and that excess is worse among people who are worst exposed. There is a very strong suggestion that the people who are exposed get more what we call early cataracts, mild cataracts. We don't know what will happen to those, whether they'll go on to a more severe form of cataract. What is very important is the speed at which they develop. But we are seeing them develop rather quickly.
The increase in cataracts is worrying for another reason. There's growing concern that the victims may have had their ability to resist disease affected by exposure to the gas.
Immunity has to do with the body's resistance. This response seems to be decreased. At least there's something interfering with it, either locally in the eye, in the humans, which is as far as we've got information on the humans, and in the animal model in a generalized way. It seems to affect several organs. Probably for ease of understanding, the relationship with human AIDS helps to explain that AIDS is a virus which reduces in a generalized way, the body's response to the body's capability to deal with infections. Now, I'm not saying that MIC is like AIDS. I'm just using that as an explanation of what the implications would be if the immune system was damaged.